Uh, well, basically, this question is easy to answer. It doesn't take long. However, the variation in time, it depends on you, basically. So how quick is your bladder is full, how quick is easier to insert the speculum, as well as the identifying the cervix, cleaning the procedure. So it takes a little bit more time as to clear the mucus, clear the cervix. In the past, we used to do it like straight away. However, now we are like more keen on cleaning the cervical mucus. The cervical mucus is one of the important steps we should give attention to. Some use aspiration, even like with pumps and negative pressure. Some use just like cotton wool, like with a very, very tiny cotton wool. And we take our time, because the more mucus it is, the less likely is going to have a successful embryo transfer. Now, having said that, I will come back again to the cervical mucus issue. So after identifying everything, and then by ultrasound scan, everything is clear. So we ask the embryologist to bring the embryo in the catheter. And the technique, as I said, like with the ultrasound guidance aid, which should be very easy, like to insert. In order to make sure that we are in the correct way, and rather not to fiddle with a catheter already filled with an embryo, we have something called like a two-step technique. One is to use the outer sheath of the catheter. You know that the catheter has outer sheath and inner sheath. So the outer sheath is used to guide and like to make a secure passage from the external os of the cervix until the internal os. Okay, so once this is secured, we ask this the embryologist to bring the inner catheter, which contains the actual embryo. So until we have this kind of reassurance that everything is fine, this is the time that it's taking. As I said, between like insertion, like cleaning, cervical mucus, putting the outer catheter sheath, and then the embryologist coming with the inner sheath, and then insert the actual inner sheath, and then deposit the embryo. All in all, it might take anything between 10 and 20 minutes. So more than 20 minutes, I would say, or half an hour, this is considered as a very difficult embryo transfer. So if there are difficulties encountering, so the main difficulty would be, one is a very tight cervix, or what we call pinhole cervix. Obviously, it should have been detected before, or some people have like a mock embryo transfer before. Some clinics insist to have a mock embryo transfer. Some people do not like have this kind of prerequisite investigations beforehand. But the embryo transfer, as I said, is within this kind of time. The other thing that might you feel that the time has like elapsed even more when we have an embryo which is not released into the cavity and trapped into the catheter. So basically, the embryologist bring the embryo, which is inside the inner catheter, and then we try to push that. We wait until the catheter is withdrawn by the embryologist, and then recheck it again under the microscope, and then I get the okay from the embryologist to tell me that the embryo has been released, or the embryos has been released. Usually, if it is one or two, we have to make sure that both of them are released. Obviously, I cannot prove it from my side under ultrasound scan, because obviously I don't know. If you also think like when we inject and then we see this whitish contrast media, this is actually the water pellet that it is securing the embryo in place. So this is not the embryo that we see. So a lot of people, like, we demonstrate and then we tell the patients, oh, this is the actual, if you see this whitish contrasted media on top of the uterus, this is the release. Yes, this is the fluid released, supposedly including the embryo. And how do we know that for sure? We wait, and that's why we do not remove the speculum. We do not do anything except when I have the okay from the embryologist to tell me that the embryo has been released and the catheter is empty. Now, if on occasions I had it, many of my colleagues had it, it's normal to have an embryo which is not released and trapped back into the catheter. Most likely because of the cervical mucus. So the cervical mucus is the one that makes like a plug and then doesn't make the outlet of the embryo smooth. If this happens, I don't want you to panic, okay? Because this happens and it's very easy to reload the embryo back to the catheter and then bring it back in. So this might extend the time of the embryo transfer. As I said, the other main reason is a very, very tight cervix or difficult way to get the way in. In extreme circumstances, like if we cannot just go in or negotiate the cervical length and the cervical until the internal os, we abandon the embryo transfer and then we refreeze the embryo. We freeze the embryo. So until we sort this out. So again, freezing the embryo again, even after thawing. Yes, I want you to be sure that this is a normal technique and this is not something out of the norm, or it will reduce your chances of having a successful embryo transfer later on. However, everyone, I think, in the field has encountered this kind of difficulty. Unfortunately, sometimes you cannot predict it. However, it is very safe to ask the embryologist to freeze the embryos again until we sort out this issue of the difficult cervix, maybe at a later stage with some dilatation, or what is the recommendation for that. And once we make sure that the cervix is back to normal, then we will envisage another like frozen solid embryo transfer.